Assalamualaikum and good day. In this online lecture, I'll be discussing about the epidemiology methods in occupational and environmental health. The outline of this online lecture would be basic concepts about occupational safety and health, legislation on occupational safety and health, basic concepts on environmental health, the types of epidemiological studies, methodological issues in conducting epidemiological studies, and finally, the source of data for such studies. What is epidemiology? Epidemiology is the method used to find the causes of health outcomes and diseases in populations. Epidemiology has become very important nowadays in view of the COVID-19 pandemic that we are still facing and probably continue to face in the next several months or maybe few more years. So when did epidemiology as a field of knowledge first started? To look into the history of epidemiology, we have to go back to the mid-19th century in London. So this picture here shows the living conditions of London at that time. Among the things that you can probably see if you were there, okay, include livestock, okay, in the streets, people living in the streets, feces being thrown out of the window, okay, you might see feces on the streets, okay, and the air was badly polluted, so much so that the visible distance is very short, meaning that you can't see anywhere that's far from you because of the smog. So during this time, okay, I believe the industrial revolution involving the use of steam engine was already on its way. Many industries rely on burning of coal to boil water, which created steam that provided the energy to move the parts of a machine. Unfortunately, the byproduct of this process is a lot of smoke, okay, which created the smog in places like London at that time. So you had a city with really poor living conditions. During that time too, there was a outbreak of cholera. So this illustration here shows a patient suffering from cholera. So basically, since there were not many people, I can't remember whether the camera was already created at that time, but back then a lot of people use illustrations based on drawings like this to give a visual idea about what's going on elsewhere. So the cholera outbreak affected many places in India, but also in London. Okay, so patients who had cholera were grouped together in a hospital. So when you think about hospital nowadays, okay, is vastly different compared to the hospitals that exist more than 150 years ago. So the hospitals back then were more cramped, okay, and that probably contributed to the spread of diseases. Okay. So back then there were insufficient understanding or lack of understanding about what actually caused cholera. A lot of people back then believed that diseases were contracted due to exposure to foul air. So something in the air actually led to a person contracting diseases, including cholera. So what is trying to be illustrated in this figure here is the march of death, okay, which cannot be stopped. And as you can see at the top here, there's like a dark cloud, okay, that I think is trying to symbolize the diseases that is being spread by the foul smelling air. Okay, you may have seen a plague doctor before. Okay, I think they are sometimes used to, you know, as a symbol of death. Okay, so back in I think during the Black Plague, if I'm not mistaken, doctors would wear garbs or uniforms like what you see over here. So it's kind of like a PPE for them. Okay, so it covers the body. Okay, it's like an overall that covers the body, the legs, long sleeve. Okay, cover most of the arms. I'm not certain whether there's gloves involved. All right, but maybe most of the attire will not be extraordinary by today's standards. But if you look at the face mask, okay, this is a unusual face mask. Okay, so during the current pandemic, okay, lots of people are wearing face masks, right? And that's to minimize the exposure of water droplets, na'uzubillah, the coronavirus. Okay, but if you look at what they wore back then, it looks like the beak of a bird. Okay, so why is it designed this way? Why does it look like the beak of a bird? The reason is because, right, and this is what some historians or researchers say, is because they need to put some fragrant, some spice, okay, something that gives out a pleasant smell in the mask itself. So remember, the understanding back then was that diseases are spread by foul smelling air. So the idea was that if you had this fragrant, nice smelling spices or maybe flowers, I do not know, okay, therefore it will actually reduce the risk of you contracting the disease. Okay, so this is not empty, it's actually containing something nice smelling, fragrant, because it is believed that that actually may reduce the risk of getting the disease. So the idea that you could contract diseases because of the foul smelling air has something to do with a theory called the miasma theory. So in London, because of the spread of cholera, a lot of people went about looking for the source of the foul-smelling air. So they would have officials going around looking for places that may be the source of something really smelly, and the reason is because they felt that it is whatever that smells bad that contributes to the spread of the disease. And this has to do with microbiology, okay, medical microbiology not being established yet at that time. So adding to the problem, okay, adding to the problem of the cholera outbreak was not only the lack of understanding about how cholera spreads in the first place, okay, meaning through microbes, based on our current understanding. Back then they thought it was due to something foul in the air, but adding to the problem was that the living conditions were really bad. So this illustration here shows one of the rooms that would have multiple occupants staying there, sharing a small space. So you would have men, women, children, probably related, probably not, all living in a very small space. So in terms of hygiene, the level of hygiene could probably be not very good, okay, judging from the illustration that we can see over here. Alright, so a doctor by the name of John Snow, okay, decided to explore the possibility of other causes of cholera. So instead of blaming the foul air, he carried out an investigation in order to find out if cholera is actually caused by something else. To do that, he did something that can be considered as novel at that time, something that is not established, something that's new. What he did was he actually got a map of the area of the cholera outbreak in London, and he then marked on the map the location of cholera cases, cholera incidents. So every time there was a cholera case, okay, he will put a mark on the map to show where the cases are occurring. So what he found out was that a lot of the cholera cases were located near a water supply, a water pump, okay. So in order to test his hypothesis that maybe the cholera was spread through water from the water pump, he actually went to the homes of those affected and asked them whenever possible, what did they do, okay, did they go anywhere, trying to get the characteristics of the cholera sufferers. And he got the information that most of them got their water from that water pump, okay. In addition, he also went to houses who lived near the water pump but did not have any cholera cases. So he found out that those people, although they live near the water pump, they did not use the water from those pumps. So he had two evidences. One, those who live near the water pump use water from the water pump got the cholera, while those who also live near but did not use the water did not get the cholera. So from those two findings, he could summarize that the water pump was the origin or the cause of the cholera outbreak. Interestingly, he also went to somewhere further away to ask cholera patients about their activities, because there was cholera patients who did not live there near the water pump, okay, but they still got the disease. So when Dr. John Snow asked them, okay, they said that although they did not live near the water pump, they kind of went, maybe passed the water pump on the way to work perhaps, okay, and took water from that pump. Right, so he concluded that the water obtained from that particular water pump was the source of the cholera outbreak. Okay, so this is how the water pump will look like back then. So what Dr. John Snow did was an approach that is still being used to this very day. In fact, it may have been applied in understanding the COVID-19 origin. 4 to 5 months ago, I think a lot of scientists speculated that the source of the coronavirus were a wet market in Wuhan. Okay, so how did they come up with that conclusion? All right, so they actually look at the characteristics of the patients that first appeared in Wuhan, look at what are their commonalities between them. Okay, because if there's something that caused that led to different patients to be infected by a certain infected with a certain disease, okay, that would mean that they all have a same commonality. Okay, there's something common about all of them. So it may be that scientists at that time speculated that the patients who initially got the initial patients of the COVID-19 were all customers that may have frequented the wet market. Okay, so that's one possibility. But what I like to highlight here is how epidemiology still uses the same techniques that can be considered as pioneered by Dr. John Snow around 150 years ago in London. Okay. Right, let's move on to occupational safety and health. Maybe epidemiology is a term that you may have heard before, but occupational safety and health, or its shorter name OSH, maybe is a bit unfamiliar to some of you. So I'll take some moments to explain, okay, the concept of OSH and why OSH is something that everyone should learn before you join the workforce, before you employ other people in the future. Right, so occupational safety and health can be described as the science of anticipation, recognition, evaluation, and control of hazards that arise in or from the workplace. So hazards are anything that has the potential to harm us. In Malaysia, okay, each year the Department of Occupational Safety and Health, or DOSH, keeps track of the kind of diseases or poisoning cases that occur among workers. So in this graph over here, we have data from 2016 that shows that among others, occupational poisoning occurred 67 times in that year. Occupational musculoskeletal disorders 173, and every year is the same. The champion would be occupational noise related hearing disorders. So you can see the magnitude of the difference between noise induced hearing loss and other types of diseases or poisoning cases. Alright, but before I move on, if I ask you, I mean, this is just a rhetoric, because we're in a asynchronous virtual lecture. If I ask you, why is it that occupational noise related hearing disorders consistently is the top occupational disease in Malaysia? What do you think would be the correct answer? Do you think it's because Malaysia is a very noisy country, or Malaysians in general have very sensitive ears, or any other possibilities? The answer is, while we cannot deny that there are many noisy workplaces in Malaysia, one reason why occupational noise related hearing disorders continue to be among the highest each year is because it's also one of the easiest occupational related disorders to detect. For example, another major occupational disease is occupational musculoskeletal disorders. This includes low back pain. If you sit at your computer workstation every day for 6 to 8 hours, sooner or later you're going to get low back pain. So that's an example of occupational musculoskeletal disorders. However, most people don't realize that that is occupational related, because many of them feel that the disorder that they experience may be due to their age or their lifestyle, or they may accept it as just a natural thing that occurs to everyone. On the other hand, with occupational noise related hearing disorders, most people can detect their hearing loss quite easily as compared to other disorders or diseases, right? When they have that ringing sound that doesn't go away, when they go back from work, or when they start to realize that they cannot hear what other people are saying clearly, or they need to increase the volume of the television when they watch TV. So usually they will not only be able to detect the hearing loss, but also attribute or blame the hearing loss to the workplace. Whereas for other types of disorders, sometimes the link between the workplace and the disorder that they are experiencing may not be clear to them until they meet a healthcare professional like an occupational health doctor. Right, so some additional information about the various disorders that can occur due to our workplaces. So this is a brochure explaining about the dangers of hearing loss induced by noise in the workplace. These are figures showing how a worker can experience slip disc. Okay, I'm sure many of you have heard of the term before, slip disc. Okay, especially if you're from the physiotherapy program. Okay, basically what occurs is the content of the intervertebral disc, okay, the nucleus actually protrudes upwards, okay, and as a result, okay, because it has herniated, okay, the content will actually press against the nerves in the spine, okay, and this creates a continuous feeling of pain throughout the day and night. So I've met a PhD student from Malaysia in Australia when I did my PhD over there. He was doing some house cleaning while he was pushing a cupboard. He was a big guy. I think he's easily 100 kilos, okay, not fat, it's just that he's big size like a rugby player. Anyway, he was pushing a cupboard and suddenly he felt something painful in his lower back, okay, like something pop. He went to see the doctor, who referred him to a surgeon, I think, and they concluded that he had a slip disc that required operation. Because he was not an Australian citizen and did not have a comprehensive insurance, the doctor advised him to get the operation done in Malaysia instead, because the cost would be too excessive for him in Australia. So he had to cancel his PhD program halfway through the program. So I think he was already in his second year. Okay, so I recall him saying that the pain that just continues, throughout the day can be described as very painful and cannot be overcome by taking morphine, which is a powerful drug that some people get addicted to. So what he did was, he not only took morphine, but he also smoked cigarettes at the same time. He explained that the combination actually relieved the pain a bit. Okay, so last I've heard, he went back to Malaysia, did his PhD program from scratch, okay, and Alhamdulillah finished his PhD. And I like to add here that because his wife was also doing her PhD with him in Australia, his wife also had to cancel her PhD. So yes, a lot of losses in terms of knowledge, okay, but the main point here is that workers experience slip disc because of the activities in the workplace. Okay, this here shows the different conditions of lungs in different people. You have a healthy lung of a 90-year-old school teacher, okay, whereas on the right here is the lungs of a 40-year-old, okay, so around my age, okay, that has progressive massive fibrosis. You do not need to be a pathologist or an anatomist to see that there's something wrong with the figure on the right. The color is wrong, the shape, okay, is wrong, right? You can see there's fibrosis over here that is colored differently, right? So this is a pathological condition that is caused by the job. And in OSH, we are very concerned about similar incidents because most people do not have a lot of choices about what goes on in the workplace. And remember, they are there in the workplace because they want to earn money for themselves, for their families. So in many situations, you have workers who have no control over what they are being exposed to in the workplace. Therefore, occupational safety and health is very crucial to ensure that everyone who goes to work is able to work in a healthy and safe workplace. Now let's look at this data from Great Britain. So this data was produced in 2005. Okay, the chart is about the estimated occupational cancer deaths in Great Britain in 2005. So an example would be asbestos, okay, contributed to close to 4,000 deaths in Great Britain in 2005 alone, and all of those deaths are due to occupational cancer, meaning a person got cancer because of his or her job. So asbestos is a huge problem because we know that asbestos is very carcinogenic. There are other causes of occupational cancers and later occupational cancer deaths, including jobs that creates exposure to silica, diesel engine exhaust. So if you have workers in the mechanics department, those who work by the roadside who are exposed to diesel engine exhaust, maybe those who work at the petrol station, okay, if I do not know, maybe their exposure is significant or maybe they're not, okay. So the exposure may actually increase the risk of getting occupational cancer. Similarly, those who are exposed to mineral oils in factories, those who perform shift work, okay, so this is slightly controversial, okay, and those working as painters. Working as painters means that they are exposed to paint day in, day out, okay. But if you are painting your home, your risk will not significantly increase. Okay. So occupational safety and health is a human right. Okay, so this has been noted or enshrined in the United Nations Universal Declaration of Human Rights. It means that it is everyone's right to work in a healthy and safe workplace. It should not be considered a luxury, meaning that if your job is a high-paying, high social class type of job, for example, a doctor, a professor, an accountant, engineer, then yes, your workplace is safe. But if you are manual laborer, like those building houses or sweeping floors or work in the sewage system, then no, your workplace would not need to be safe. It doesn't work that way. Okay, when we say something is a universal right, a human right, it means that everyone has the similar rights. Okay, however, okay, once upon a time, a safe and a healthy workplace was not a human right. Okay, in factories in the 19th century, a lot of people lost their lives or lost their limbs, okay, their fingers, their arms, their hands, because they work in factories that have machineries that are very hazardous. So how did occupational safety and health come about? Okay, who actually became the proponents or champion, okay, occupational safety and health? OSH was examined even before the Prophet Isa alayhi salam was born. So during the time of Hippocrates, the symptoms of lead poisoning among miners were already described. Okay, and centuries later, okay, during Paracelsus' time, he attributed the cause of lung disease among miners to vapors from metals. In addition to that, okay, Bernardino Ramazzini, okay, advised patients to learn about occupational disease by studying the work environment. And Dr. Percival Potts, who was around in the late 18th century, he identified the first form of cancer, which was the scrotal cancer among chimney sweeps. And fortunately, these often involve chimney sweepers who are often very young. If you heard of the movie Mary Poppins before, you know that the setting of the movie, by the way, I'm referring to the original, not the remake. So the setting of the movie was, I think, maybe in the 19th century or 18th century England. So a lot of people were still using the fireplace to cook, for example, right? Nowadays, if you go to England, you cannot use a fireplace, you'll be fined, okay, for polluting the environment. Back then, you had a fireplace. So the purpose of a fireplace, the function of a chimney is as to provide a route for smoke that burning coal or firewood would emit, okay, to escape the house. Without a chimney, whenever you cook, right, it'll be like what happened when you burn your food on the stove. Okay, the smoke will just stuck in the ceiling, near the ceiling of your kitchen, and then spread to the living room. But if you had a chimney, okay, the smoke will actually go up, okay, along the chimney and to the roof and escape to the air. That is why the quality of the air was bad. If you still cannot figure out what a chimney is, you know, our friends who believe in Santa Claus, so Santa Claus will enter the house using the chimney. Okay, so that's kind of irrational, because when chimneys are used, usually they will have problems of clog. The reason why they can get clogged is because the smoke that is produced when you burn coal or firewood will contain carbon. They will stick on the walls of the chimney. Okay, so as time progresses, there will be more carbon, and that will actually obstruct the flow of the smoke going upwards. In order to solve this, what people do is they employ chimney sweepers, usually children, who are small enough to climb into the chimney and use a long rod, okay, and at the end of the rod will be a brush, and they will just sweep, okay, sweep the carbon, which will fall downwards, right? Okay, and usually on top of them. So Dr. Percival Potts found a relationship between the occurrence of scrotal cancer among these workers and their exposure to the soot, okay, that they sweep as part of their job. Okay, so nasty job, not only is dirty, okay, is not respected, but it is also dangerous because it causes scrotal cancer. Sad, Alright, so time goes by. You know, you have the Factories Act in 1833 to improve workplace safety, okay, and then you have in 1867 the first industrial nurse, and in 1897 the Workmen's Compensation Act, which in Malaysia is analogous to the Social Security Act, SOCSO, or in Malay Perkeso. So everyone must be aware about SOCSO or Perkeso. It's an avenue for you to be compensated, kinda like a takaful or insurance, if you get injured, harmed, or die during work. And that is defined as the moment you travel to work and return from work until you reach your home. Okay, so please be aware of that. A lot of people are not aware, and therefore they don't seek compensation when they get injured or their loved one gets injured. Okay, so since then there have been so many advances in the legislation pertaining to workplace safety and health, which I shall not describe in detail. We have discussed advances in occupational safety and health, beginning with what Hippocrates did a few centuries before Prophet Isa a.s. was born, until the many more recent legislation changes pertaining to OSH. The question now is, what about Islam? Has Islam contributed or discussed or emphasized on occupational safety and health? It has, in many ways, and I will provide two hadiths to explain them. Number one, this hadith that was narrated in Bukhari. Your slaves are, the Prophet ﷺ said, your slaves are your brethren upon whom Allah has given you authority. So, if one has one's brethren under one's control, one should feed them with the like of what one eats, and clothe them with the like of what one wears. You should not overburden them with what they cannot bear, and if you do so, help them in their hard job. Very beautiful hadith, especially from the OSH perspective, because number one, it emphasizes on the importance of taking care of a worker's welfare, right? Because a worker is working for the employer, and therefore the employer has to ensure that the welfare of the worker or employee is taken care of. But I think number two is just as important or even more important. Here the hadith is talking about slaves. So we know that slaves have lesser rights than a free person. I do not want to explain more, but you know that there are things that we can expect from slaves that we cannot expect from a free person. Okay. Yet in this hadith, it has been stressed that even though a person is a slave to us, we must ensure that the welfare of the slave is taken care of in the matters of their clothing, their food, and their job. Okay, so if the Prophet ﷺ emphasized on the importance of taking care of a slave's well-being, what more a worker who is a free person, right? Then we have this hadith, which is included in the Riyadus Salihin, a hadith where Abu Hurairah reported that the Prophet ﷺ said, belief has over 60 branches. The best of them is the words, there is no God but Allah. And the least of them is to remove an obstacle from the road. If you look at the latter part, the least of faith, okay, or belief, is to remove an obstacle from the road. And this hadith is agreed upon by both Bukhari and Muslim. It's very interesting, okay? Belief is very important. Okay? So belief is very important, okay? Because it's central to who we are as Muslims. And it's really interesting that although there are 60 branches of belief, one of them is about removing an obstacle from the road. If you think even further about the act of removing an obstacle from the road, logically is an action that is not really for yourself. Think about it. If you walk on a road and you see, for example, a nail, okay, an upright nail that you know if someone steps on it will get hurt, okay, so what do? You have a lot of things, a lot of choices. You could save yourself only by just stepping to the side and just keep on walking. Wouldn't that save you? It would, wouldn't it? But if you remove it from the road, who are you truly saving? You're not truly saving yourself, although in a way, yeah. But what you're trying to do, so what you end up doing, is you're saving the people who will walk the road after you. Okay, and do you think you know everyone who walks that road after you? No. So basically, when you remove the obstacle, you actually risk removing the obstacle for not only yourself but so many other people that you probably do not know, and they would probably not realize that you did them a great favor by removing that obstacle. So this is a very beautiful hadith because it describes, belief to include an action that is selfless, okay, an action that is not about your own self, is also about other people, and that other people is not your family members who you know or your close friends. Other people could be people you don't even know they exist, right? So when you look at this and we think about OSH, that is a common theme, okay? In OSH, you're trying to create workplaces that will be safe and healthy for workers. In some cases, yeah, you will know who are the workers affected by your actions, but sometimes you don't, okay? But that does not minimizes your motivation to make improvement, because you believe that the important thing is people can be safe and healthy at work so that they can return home to their loved ones. What's the situation in Malaysia like? According to more recent statistics, the occupational accident and fatality rate has decreased in the case of accident rate, but has increased for the fatality rate. Okay, so here the occupational accident rate seen over here, more recent one, 2.88, represents 2.88 occupational accidents per 1,000 workers. On the other hand, for fatality rate, 4.84 represents 4.84 fatalities per 100,000 workers. That's actually a lot if you consider that maybe a university will have maybe tens of thousands of workers, probably not workers, students, okay. When you add the number of staff, then probably you have between 30 to 40,000 maybe, okay. So not really 100,000, but if 100,000 workers will have a fatality rate of 4.84, so half of it will be about 2 deaths. A single death is already a lot, okay. So that is why we need to do our best to reduce the number of the fatality and accident rates. One thing that I'd like to add though is that in a lot of these rates, we have to examine how they come up with the figure. One issue that could arise with such statistics is that the rates depend on the number of cases that were reported to the authorities. For example, the number of deaths that occurred because of work in 2016 were used to calculate this figure over here. Because of that, it's possible that there may be cases that were not detected. For example, maybe there were cases that were not reported to the authorities because of the fear of being prosecuted by the authorities. So rather than risk prosecution, there may be organizations or companies that withhold information about injuries or deaths due to workplace, especially if those involved were illegal foreign workers, because technically or on paper those workers do not exist. So reporting their injuries or their fatalities can trigger plenty of investigations that can trouble the organization or company. It's for this reason that sometimes illegal immigrants who work in Malaysia may be exploited by the employers, because these workers may feel that they don't have an avenue to complain about mistreatment by employers. So that means that there's a lot of complex issues that can affect the calculated accident and fatality rates in a country. What is the cause of an accident in Malaysia? There is a method for calculating the cost of an accident, in that you can calculate the direct cost, and that includes compensation, transport of the deceased, and the indirect cost. For example, the loss of production due to death or injury. In the case of a pit swamp logging, where a chainsaw operator was struck by, I think, a falling tree and died, the grand total calculated was 105,800 ringgit. In my opinion, however, I think this value grossly underestimates the true cost of an accident, a fatal accident. And that's because for a road traffic accident, I believe Miros determined that roughly a single traffic accident, a single fatality due to a traffic accident can economically cost roughly 1 million ringgit per death. For that reason, I think 105,800 ringgit is a underestimation of the actual cost. When we look at how this value was calculated, I think there's other aspects that were not taken into consideration. For example, the compensation may actually be higher, okay, depending on who is compensating, and then there's the impact on the deceased family, the loss of income, okay, and many other aspects that I think this calculation here did not consider. Moving on, let's look at the legislation on occupational safety and health. We're going to do this quickly. The point is to inform everyone that there is an act that makes it compulsory for wherever you work later on in Malaysia to be safe and healthy for you. Similarly, in the event that it's your risky, you become an employer, you become a boss later on, then this act makes it compulsory for you as the boss to ensure that your workplace, whether it's a clinic, a shop, or wherever or whatever, it must be safe and healthy for you, yourself, and your workers, and not to forget your customers, clients, or patients. So all those aspects are covered by this act here. That is why I would like to take just a quick moment, okay, to explain the gist of the act, because there are a lot of employers as well as workers who do not realize not only the existence of this act but also the significance of its content. Alright, so this act is to secure the safety, health and welfare of persons at work and protecting others, blah blah blah. Okay. Some of the main components or points of this act include the general duties of employers and self-employed persons, meaning if you're the boss or if you're a self-employed person, okay, then you have certain duties to your employees, your workers. It shall be the duty of every employer and every self-employed person to ensure, so far as is practicable, as logical as possible, the safety, health and welfare at work of all his employees. That means that although it is not explained in detail how to ensure the safety, health and welfare at work, the point is your duty as an employer or self-employed person to ensure that the workplace is safe, healthy, and considers the welfare of your employees. If you fail to follow this rule, then you can be prosecuted by the government, something that some companies have underwent before. Next, general duties of employers and self-employed persons to persons other than their employees. And this include people like patients coming to your clinic, your customers and your clients. It shall be duty blah 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 to conduct his undertaking blah 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 so far as is practicable, that he and other persons not being his employees, okay, are not exposed to risk to their safety or health. What this means is, if you imagine an old lady coming into an optometrist clinic or shop or center, whichever is the appropriate term. If the customer, patient or client sits on a chair that is wobbly and falls down, and unfortunately because of the person's age breaks her hips, and we know that this can happen to senior citizens if they fall down, then there is ground, okay, for the employer or the owner of the optometrist clinic, shop or center to be prosecuted by the government, because according to this law, the employer must ensure that the workplace, which covers, you know, the area the moment you enter through the door, okay, until you leave the door, that area should be safe and healthy for everyone entering it. Okay, so if you think about it, this is a very powerful and a very, how you say, a law that can influence or affect many people. That's because no matter what industry you're in, if it's a workplace and you are the employer or the owner, then it's on you to make sure that the workplace is as safe as possible. In the case that I've explained to you just now regarding the wobbly chair, what could happen is, if you're the employer or the owner, you can be prosecuted by the government if they can prove that the wobbly chair was something that, number one, you should have known, and number two, you could have prevented. Okay, because remember, the law lists the responsibility as so far as is practicable, meaning that does it make sense that the employer could have prevented it from occurring? If you say yes, because how come you did not know that you have a wobbly chair? Or if you already know, then why didn't you put it away? Why you still let it be there and later used by someone? Okay, so that means that the expectation for the employer to be able to remove the hazard is appropriate. However, if, for example, the case involved the old lady entering the optometrist clinic, and while she is walking towards the display cabinet, suddenly a meteor fall from the sky and hit the optometrist center and exactly lands on top of the old lady's head. Okay, in that case, it's not practicable to try and prevent that from occurring, because that is something that is totally unexpected. And if you ask the employer, or if you ask yourself, is it something to be expected that, you know, you could have prevented that from occurring? The answer would most likely be no. So the law is not too rigid. Okay, it allows it allows the enforcement to be done in a fair manner, both to the employer, workers, and other people. But the point here is there is a great responsibility on the shoulders of employers and bosses. So always remember that if you someday, because of your risky, you end up being an employer, then you must realize that there is a law that allows others to prosecute you because you did not play your role in ensuring the safety and health at the workplace. Just to add a bit on the Islamic perspective, I recall there was a story about Umar al-Khattab radhiyallahu anhu, when he was the Khalifah. One day he was seen sweeping some rocks by the roadside. So those who saw him asked him, why are you doing this? And that's a very logical question, because when Umar al-Khattab became the Khalifa, during his tenure or during his administration, the Islamic nation grew to a very large size. So I can't remember where does the border of the country starts and ends, but basically they expanded to the east towards Iran by defeating the I forgot the Persian kingdom, and they also defeated the Byzantine army. Towards the west. Okay, so they expanded, and as the Khalifa of such a large, respectable country, to be seen sweeping rocks, by the roadside, would surely trigger a sense of curiosity. So someone saw the Khalifa doing that and asked him, Amirul Mu'minin, why are you doing this? And he replied that, I worry that there will be some livestock or goats or sheep, I can't remember the exact words, that will pass by this road and they would trip over these rocks. And when the day of judgment comes, they will complain to Allah that Umar al-Khattab did not do his job. So when you think about it, his concern is so great. His concern for his subjects is so great that he wasn't sweeping the rocks, okay, to protect his countrymen or his human subjects. He was concerned about the livestock, the animals like sheep or goats that would be harmed. So his sense of responsibility, okay, is very strong and wide. Okay, so that's a very Islamic thing to do, and I believe that we can actually follow him exactly what he did, but at least the spirit of what he did, to be concerned about our workers or our colleagues, not really because of the law, but because we fear what could happen on the day of judgment. Okay, for Malaysian universities, okay, if you look on the right, there's a lot of resources on how you can protect yourself, while on the left is more general to the higher education institutions in Malaysia when students go out to do any recreational activities outside the university. In addition to what I've already mentioned just now, there is also a duty for employers to formulate safety and health policy, which is a written statement regarding the safety and health at the workplace that shall be displayed or notified to all employees. In the Kuliah of Allied Health Sciences, if I am not wrong, the Dean has signed a safety and health policy for everyone to see. So what does this safety and health policy do? What it does is, it represents the commitment of the employer or the boss, as well as the organization, in ensuring that the workplace is safe and healthy for everyone. And the reason why the signature of the boss is there is because it's like a promise. Okay, a promise that has been that involves the signature of the boss to signify how committed the boss or employer is towards the policy. And furthermore, it's actually kind of binding. So in the event that something happens in the future, na'uzubillah, and someone argues against the dean or whoever is considered the boss, that someone could actually bring up the safety and health policy by asking, did you not promise to take care of the safety and health of this place? Because you signed a declaration to do that. So how do you, if someone accuses you or argues against you with that statement and bring out a copy of the declaration, a copy of the policy, what else can you do besides saying yes? All right. So it's not a small thing to have a safety and health policy, because it really shows your commitment. So this is an example of the safety and health policy. It's kind of dated because it was signed in 2018. Back then, our dean was still an associate professor. Okay, so there's a lot of commitments listed here. Let's not forget that workers also are responsible. Okay, they have to comply with what the boss says, comply with the regulations, do whatever is necessary within legal boundaries to take care of your safety and health. Because the Act does not say it's only the employer's role. The workers too have to play a role. It's everyone's role. Other than that, okay, the law also states that there has to be medical surveillance done in the workplace if it is required. Okay, so medical surveillance basically is a surveillance that is conducted often by a medical doctor, a trained medical doctor in occupational health, in order to determine the extent of an occupational related disorder in the organization or company. Right. So other than that, the law also states that large organizations, including like IRUM, should employ safety and health officers whose job is mainly to take care of the safety and health in the workplace. So they are the ones who do all the nitty-gritty things to ensure that the workplace is safe and healthy. They are not the employers. Okay, the employers are responsible for the overall safety and health, but the employers may be too busy running the company or organization. Okay, for example, director or the dean. So usually you'll have a safety and health officer who does the nitty-gritty work with regards to managing OSH. In our university, we have the Occupational Safety, Health and Built Environment Department, OSHB. These two individuals are from Kuantan. Okay, the rest I think are from Gombak. I think lastly, okay, the law also requires the establishment of a safety and health committee at the place of work. So in CAS, we have a committee comprising of academicians, administrators, okay, supporting staff to oversee the safety and health issues in CAS. So these are members of the committee. Okay, you can see that most of the head departments are in the group, okay, along with the clinicians, the technologists, and some academicians, and we have the dean being the chairman. Oh, I forgot this part, right? The law also says that any dangerous occurrence, accidents, occupational poisoning, diseases should be notified to the government, specifically the Department of Occupational Safety and Health. This is where this is how the government can keep track of the number of accidents or diseases due to occupation in Malaysia. So how is the report submitted? Nowadays we have an online submission form, which is great compared to before where you have to print out a form, fill it in and mail it to the government. And because things are online now, you can actually go through some of the submitted cases on fatal accidents, for example. So over here in the in a portal that you can access at DOSH's website, you have a list of cases. This one dated 9 of November 2019, which is less than a year ago. A contractor died falling from height. Where? Construction site in Johor. What happened? A contractor worker was killed after fell from a height of 9 meters. 9 meters is roughly either 2 or 3 story, the second floor or the third floor, while dismantling cross beam soffit. I'm not sure what that is. Okay, the investigation carried out found that the employers failed to maintain a safe working system to ensure the safety of the employees working at height. The failure of the contractor to provide adequate training for working at height. So it is most likely, even though it's not mentioned here, that the contractor who fell was not wearing a harness. In Malay, I think it's called labah or something. Basically, it's something like a vest that you wear that is attached to a rope or cable, and the other end of the rope or the cable you will attach to something secure. That way, if you fall down from a very high location or spot, you will not fall down to the ground. You'll be hanging, okay, by the rope. So this is compulsory for anyone working at heights. Probably, you know, that person wasn't wearing it. Okay, so there are a lot of things that can be done, okay, in preventing accidents, occupational related diseases. There are engineering solutions, there are administrative solutions, there are, you know, general solutions. I'm not going to go through in detail here because this is not the point of today's online lecture. Okay, let's move on to environmental health. Okay, so I've described very quickly the concept of occupational safety and health, whereby workers can get harmed due to their job. But here we're not talking about the job, we're talking about people being harmed due to the environment. And there have been a lot of recent cases that relate to environmental health. But before that, okay, some general information regarding environmental health. 24% of diseases are due to environmental health issues. 23% of deaths are due to environmental health issues. Environmental health issues include unsafe drinking water, poor sanitation and hygiene, indoor air pollution, as well as outdoor air pollution. So this is just a drawing, okay, of a situation in the past where cholera may be spreading to New York, and this is supposed to be representing the guardian, perhaps, okay, who's asleep, not aware that cholera is slowly approaching the city. One recent environmental health issue that became quite popular in a lot of discussions among experts, among netizens, is the Sungai King Kim chemical dumping. If you recall, there were many students who vomited, had a headache, who had to be brought to hospital because they suspected something, due to something that they suspect may be in the air, right? And it was believed that there were chemicals in the air that were coming from chemicals that have been dumped in rivers. So this is an example of an environmental health issue, meaning you have a group of people that are affected, okay, because of the environment. Okay, this is to show the air quality index. Okay, I believe that the higher the air quality index value, the more polluted the air is. This was in September. I can't recall whether 16 represents 2016 or 16 represents 16 or September. Anyway, this was during the height of the haze. Okay, Malaysia and haze is a seasonal thing, I think. During the dry season, there is a high chance that we will experience haze in certain parts of the country. So there was a time that Kuching actually had a reading that was as high as 247. Okay, so this has created a lot of health issues among those living near these areas. What are the impact of severely very poor air quality because of the haze? So these pie charts show that the problems relate to productivity loss. Okay, people are less productive because of the haze. Flight cancellations, planes cannot fly, tourists do not come, decline in tourist arrivals, decline in fish landings because the fishermen may not be going out to sea, cloud seeding, the cause of trying to artificially trigger rain, cause of firefighting to put on fires, to put out the fires. Finally, the cause on mass that nowadays is ubiquitous or is normal. Alright, in order to carry out analysis in environmental health, you can do it at different levels. It could be individual level, it could be at the population level, it could be at the ecosystem level, it could be at the molecular level. In terms of challenges in environmental health, unlike occupational safety and health, where you have a workplace that has a known number of workers and non-workers, meaning you know their names, okay, their characteristics and so on. In environmental health, it's difficult because when you talk about environment, it's an environment that may consist of so many people, different background, different races. The age also is, the range of the age is also much wider. In the workplace, we know that they often belong to a certain range of age, okay, maybe above 18 and below 65. But if you're talking about the environment, for example, the environment in Kuantan, you have all from newborn all the way to maybe 80 plus or 90 plus. So that's a challenge by itself. In environmental health, you're dealing with so many types of people who each may present different impact on their health, like age, gender, race, and so on. Okay. And besides that, it's also difficult to find unexposed comparison group. Why is that? If you are familiar with some epidemiological methods already, then you would know that one type of study that you can carry out is called a case control study. So in a case control study, you try to examine a group of people who have been confirmed to have the characteristic that you are studying about. For example, a group of people who are positive COVID-19. So that will be the case. The control would be someone who definitely do not have COVID-19. So with a case control study, what you can do is you can try to figure out what is it that makes people get COVID or do not get COVID. So maybe by comparing the case and the control, you can figure out what are the differences between this group that may explain one group having COVID and the other not having COVID. Maybe is the groups in the control group, they don't consume exotic meat, while the case group, all of them eat exotic meat, like pangolin, bats, wild dogs maybe. Okay, this is just an example, right? Not implying anything about anyone in particular. Anyway, that's a case control. That's a basic concept in behind case control. But for environmental health, the problem is, how do you find a case and a control from a group of people living in the same environment? It's difficult. For example, if you want to conduct a study on whether the environment in Kuantan is affecting whether certain aspect about environment in Kuantan is affecting the health of its population. So you will get a case from people living in Kuantan, okay, that has the characteristic you're looking for, that has been exposed to the environment, and by right you should have a control that although they are similar to the case in many ways, but they are not exposed to the environment that you are studying about. So that's kind of difficult, because how do you truly know, the control is unexposed in the first place? Because they also live in the same area. it's most likely that everyone in the same area are exposed to the same thing. So that's a major challenge. Right, so as I mentioned before, in OSH it's kind of easier because usually not only is the size of the population smaller, because the number of workers are usually lesser than the number of people living in a town or city, but you also are able to define or determine who the workers are, because you have their records in the human resource department and so on. Besides that, for environmental health, the exposure level is often very small. Okay, whereas for occupational safety and health, the exposure is usually conversely much higher. For example, if you say what is the exposure level of people living in Kuantan to diesel engine exhaust, if you're taking a look at throughout Kuantan, probably you'll find people who are exposed, okay, but the level of exposure would be low, because for most people they don't get exposed to the exhaust very often, and even if they do, it's only for a brief moment, so the exposure level is low, and that makes it difficult to study about its effect. On the other hand, for people in workplaces, for example, if you are a police traffic officer, or if you work in a workshop for fixing vehicles with diesel engines like tractors, buses and 4x4s, then the level of exposure towards diesel engine exhaust would be much higher. Okay, even then, the implications of being exposed to a nasty agent in environmental health, although the level is relatively lower than in occupational setting, the danger from environmental exposure is usually higher overall, okay, because you have a lot of people being exposed, and the duration of exposure is usually very long. With workplace exposure, once you go back home, you're no longer at the workplace, then theoretically you're no longer exposed. Number two, one day you may decide to resign and continue your career elsewhere, but environmental exposure is usually long and lasting, because if you live in Kuantan, then you will be exposed to the environment in Kuantan throughout the time you're here. If you were born here and you plan to work here and get married here and just stay here until you're old, then the duration of exposure is really long. Other challenges include the population of people in an environment comprises of heterogeneous population, because like I've said before, if we use Kuantan as an example, then you have newly born babies all the way to very senior citizens, people in their 80s, 90s and so on. So you have a very wide range of age groups, and that makes it more difficult in conducting analysis, because if you're making comparisons, then comparing a group that belongs to a certain age to another group that belongs to another age can become complicated. But for OSH, okay, usually most of the workers belong in similar categories. For example, age, okay, although not everyone is 20 plus or 30 plus, but they are the working age, the productive age, 20s, 30s, 40s, and maybe 50s. Okay, very few workers are in their 60s because they often retire before they reach that age group. So in examining evidence about the origin of diseases, we can actually use various types of evidence. However, not all evidence are equally important or valid. The best is what we call findings from systematic reviews. So systematic reviews are often articles found in journals that try to summarize the findings of many research papers. So for example, if we're asking what is the impact of weather, okay, the ambient temperature on COVID-19 transmission, is there any effect? So if you're conducting a systematic review to answer that question, what you do is you'll get about 10 to 20 research papers who have studied that topic, and instead of just saying, okay, 2 papers said this, 3 papers said that, blah blah blah, instead of doing just that, what you will do is you'll do some sort of statistical step called meta-analysis to summarize, to combine all the evidence in one statistical analysis, and then make a conclusion based on the 20 papers that you have analyzed. The evidence show blah blah blah. So systematic review is at the top in terms of level of importance, validity of evidence, and it's at the top because it is not based on one research. It's actually based on a group of research papers. So that's at the very top, and it's also quite hard to do. Next, you have critically appraised topics, okay, evidence synthesis and guidelines, followed by critically appraised individual articles. So with critically appraised topics such as evidence synthesis and guidelines, it's kind of similar to systematic review. It's just that rather than summarizing different papers all doing research on the same thing, these are based on guidelines. They are also not relying on the meta-analysis part, okay, if I'm not mistaken. And this is followed by critically appraised individual articles. So this is where individual articles are used rather than a group of research articles concurrently. Okay, so these are methods that involves going through publications, what other people have done, and use their finding to make a statement. Here we have randomized control trials. Okay, so randomized control trials is a form of study where you actually compare the effect of an intervention in a clinical setting with a control that may receive placebo or may not receive anything at all. And it's called randomized because the distribution of people to join the groups are randomized, and so there's a lot of things that need to be controlled, okay, to make the comparison between the different groups. After that, you have cohort studies. So usually in cohort studies, you actually observe the cohort for a significant amount of time to see whether being exposed to something actually increases the risk of developing something. Okay, so maybe you have at the moment two groups. One group is exposed to diesel engine exhaust, another is not exposed to the diesel engine exhaust. So what you can do if you're doing cohort studies is you can just track their health for the next 12 months and see whether after 12 months there will be a difference between the two groups. Okay, so case controlled studies, okay, it's kind of similar to the cohort studies, okay, but here, you know, you would be looking at people who already have the disease, okay, and instead of following them for some time to see what would happen to them in the future, here what you could do is you already compare those who have the disease with those who do not have the disease and try to look back in the past, in their past, what is it that led to one group having the disease and the other not having the disease. Okay, and at the lowest level of this pyramid of hierarchy of evidence is expert opinion. This could be, for example, asking a professor in virology what does he or she thinks about the origin of COVID-19. So he or she may answer based on his or her expertise, but that alone is not enough, okay, to be considered as a strong evidence to influence policy making. Usually for policy making you have to go much higher in this pyramid. Okay, so this is a case study discussing on incident studies. Alright, so you have a study that recruited and followed up over 40,000 participants, meaning that basically what they are trying to do is they're trying to see in the coming years what were the mortality rates and causes of death for the next subsequent years and decades, right? And it was this study that in 1954 found some preliminary results showing evidence to link smoking with lung cancer and increased mortality. Okay, so this is how we can actually show the association between a health outcome and a certain factor, for example. Okay, so what are the types of epidemiological studies? We have incident studies, which either look at cases prospectively or retrospectively. This type of studies compare those exposed with not exposed to establish cause and effect. So they're trying to see, you know, what are the new cases that can come up when in two different groups, one group that has been exposed and another group that has not been exposed. So the idea being that if group A was exposed to something and then developed disease X, in group B the group members were not exposed to that something and therefore they did not develop disease X. So an analyst who looks at these findings would suggest that whatever that group A is exposed to explains why they are getting the disease. Okay, so this is how conclusions can be made by comparing those who have been exposed to those who have not been exposed to the thing that you are trying to study. Alright, so incidence studies, also known as cohort studies. They are challenging in terms of cost, because in order to track their health for the next several months, the researcher would have to spend time and effort and money to contact the subjects or patients. And if the exposure is expected to give an impact in 5 years, therefore the researchers may need to follow the same group of participants for 5 years. So this is the the design of a cohort study, right? Next, we're going to talk very quickly about relative risk, which I think you have learned already. The relative risk, or RR, of an event is the likelihood of its occurrence after exposure to a risk variable as compared with the likelihood of its occurrence in a control or reference group. So this shows a study that were designed to highlight the differences, between those who are taking the medication and those who have taken placebos. So the relative risk in this case is 20 over 8.33 or 2.40. I hope you remember how to calculate RR. This is just additional information that you can use to calculate the relative risk. This table here shows the cohort study about an environmental health issue in 1976. Okay. Besides cohort studies, you have case control studies. They are considered to be more efficient than cohort studies because only a sample of non-exposed are studied. And when you compare using odds ratio, and that means that you are comparing the odds of exposure to a certain factor in the exposed and non-exposed. So in terms of the study's design, it is considered to be more efficient. Okay, just the outline of the study that you can do. Alright, so this is just to show the calculation of odds ratio, which you can do on your own later. So again, odds ratio, the case control. You also have the 95% confidence interval, which represents a range where the true value may be found. Okay, for prevalence studies, they are often studies that involve non-fatal diseases because of the difficulty in detecting incidents if patients have already died. They are also known as cross-sectional studies, and they refer to the number of cases in the population at one point or during a period. They are cheaper and easier than incidents, studies about incidents, but they lose some information such as age, when disease first started, or exposure preceding disease, meaning that there are a lot of information that cannot be obtained or may face difficulty in obtaining when a person carries out a prevalence studies. Okay, for example, age, when disease first started, exposure preceding disease, and so on. How do we measure the level of exposure? Exposure refers to the presence of a substance. Dose refers to the amount of substance that reaches susceptible targets. Exposure data need not be perfect, but quality must be similar in comparison groups. What about subjective measurement of exposure? This includes questionnaires and interviews. They're good for historical exposures. They can be valid and reliable if these are well. In terms of frequency and timing of measurement, increasing the frequency would yield more precise results. Frequency can be increased by adding more participant or more measurement per participant. Timing would depend on the type of exposure, such as chronic effects. Moving on, bias or systematic error. These are errors that can affect the validity of research. Confounding bias. Groups cannot be compared in terms of a risk factor because other risk factors exist. So that's confounding bias. Selection bias. Students in group are not representative of population. Information bias. One group are more likely to recall exposure than the other. So what are the sources of health? What are the sources of OSH-related information or environmental health-related information? You can actually get information from the death certificates because they sometimes list the cause of death as being falling from a high workplace. So that alone allows you to conclude that the patient passed away when he or she fell from a high spot. Okay, so death certificate, because there is a section for cause of death. So you can try to pinpoint whether the cause of death is due to environment, OSH, or something else. Similarly, hospitals, because they keep track of your health, then it's likely that they have information about environmental and OSH-related incidents. Worker compensation, like SOCSO, also has a lot of information because they manage the compensation given to people who are injured or who pass away. Alright, so because the compensation requires a declaration of what happened, then they would be a major source of information. The press refers to mainstream media like New Straits Times and so on. Sometimes they report on accidents, including good information. Then there's the coroner, okay, because they are involved in investigating cases, specific cases, and OSH authorities because they are the ones who are supposed to manage the OSH issues in our country. Right, so we've reached the end. Thank you very much for listening or watching. It is a pity that I did not get the chance to meet you personally. However, having said that, I wish you all the best. If you're in your final year, probably not, but just in case, then all the best in your future, and hope when you think back of your time in this university, you don't think of pandemic. Alright, so Assalamualaikum and good day.